Hi, this is Dr. Virender Sodhi. Lately, measles has been in the news, especially after there has been a case reported out of Disneyland where a infected person has spread the infection, and so there is a lot of fear among the common public and even confusion among the scientists and doctors alike. The measles vaccines gives around, according to CDC, 99% effectiveness. So if you just look at that number, 99%, sounds very good number. But if you start, dissecting that number, that means if we give 1 million vaccination, 10,000 people will have no effect, period. And if you take 100 million people, that means 1 million people will have no effect. And this is always my argument that when you have this kind of numbers, do you see that 1 million people out of 100 million has died out of with the measles? Yes, in the 1800, when the measles, people did not know how to deal it right, especially in Europe, a lot of people used to die. I think there was a death rate of 50% in France at one time. But by the later part of the century, even in America, when this measles vaccine was introduced in 1963, the death rate from measles has already fallen to 1 to 2%. So this is very crazy when we claim that there is a 75% reduction in the death rate. That is a wrong statistics right there. And I will send you some links for that to go for more deeper study. And on top of that, now this is another interesting aspect. There was a paper published last year in the Clinical Infectious Disease, which was authored by the Bureau of Immunization, New York City Department of Health and Mental Hygiene, National Center for Immunization and Respiratory Diseases, and Center for Disease Control and Prevention. And they look at the evidence from 2011, where in New York there was a measles outbreak. And what they found that people who actually was spreading the infection or got infection was fully vaccinated with 2 times vaccinations. So it's interesting that even if you got vaccination, there is still people will get the infection. And according to this study, the 88 people who had vaccinations done, out of them 4 were confirmed that they have 2 doses of measles containing vaccination in the past. So that's around 5% failure right there. And so I think it's interesting. Yes, people will get measles and there are some complications with it, like any other disease. The most weaker, will get disease more bad, and like young children and the older people. But most of us will fight. I've practiced 7 years in India, and I used to see so many measles patients, especially in the winter season these days. And this was called khasra. The local name for that is khasra. And people will come to me, and I must have seen at least in 7 years around approximately 1,400 to 2,000 patients, if I'm not wrong. And none of these patients has died in my care. We were using a lot of hydration. We were giving some Ayurvedic supplements. There is actually plant which is a mustard family plant which is called Khub Kala, and we used to boil that water and ask them to give it. And the idea was to get the measles out. So rash which comes out was good, and we don't want to suppress measles. The Ayurvedic philosophy was you don't suppress, otherwise you get diseases like Crohn's and ulcerative colitis, and there may be some link with that too. So I will send you these links, and you can be your own judge and read it and see what is real. And I'm all for evidence-based medicine, and hopefully you have enjoyed this podcast. Stay in touch. Thank you.